Hi, my name is Gregory Roxon, CEO of MPHARMA, all the way from Ghana. And the story of MPHARMA began actually in 2009 when about 84 children in Nigeria died from consuming a baby feeding mixture that was adulterated. Now these kids kept coming back to the hospital with the same symptoms, but because no one could connect the dots and they were seen as isolated cases, no one could actually say, hey, if we have 4 kids all having the same reaction to the same medication, something probably wrong with that drug. You have to take a closer look at. Now this story is just one example of the bigger problem we have with safe medicines in Africa. Out of the 46 countries on the continent, just about 4 have some kind of drug monitoring system. While developed countries like the United States has MedWatch, which is their FDA drug monitoring system, or the Lucas scheme in the UK. Most African countries will have the technological solutions to be able to easily identify patients who are suffering from ADRs. So we came up with the idea of MPHARMA, which is pharmaceutical data and drug management software. The first step in this process is that MPHARMA provides a mobile prescription application that enables doctors to digitize the paper prescription that they normally use to write prescriptions. Because when a paper prescription leaves a doctor's office, it is hard to track. Now with MPHARMA, a doctor easily takes out their mobile phone, with a feature from the smartphone, they can write a prescription, and once the prescription is sent, it is encrypted and stored in our cloud. And it generates a unique code which is sent as an SMS to the patient. The patient takes this unique code, can go to any pharmacy of their choosing, provides that unique code to the pharmacy, and they can retrieve that prescription from our cloud server. And before they fulfill that prescription, they include the manufacturer of that medication, of that drug. Now, what this enables us to do is that we now have data about the prescription that was sent, where it was picked, who supplied the medication, who manufactured the medication. And let's say a day or 2 after the patient goes home, they receive an SMS from their doctor asking them to use simple binary feedback, 0 for negative, 1 for positive, to indicate their reaction to the medication. Now with this, we can create a subset of patients who are having positive reactions and negative reaction. And based on that subset, we can identify patterns by comparing all those on that particular medication who are suffering, whether it's a good reaction or negative reaction, and use that to help governments identify causality of that particular reaction in the supply chain. So, MPHARMA is based on, our business model is built on a simple premise that pharmaceutical companies are willing to pay big bucks for high quality data in real time. Think of what Bloomberg LP does for the financial markets. That's what MPHARMA is doing for the pharmaceutical industry. Because what we have is that we are building the most powerful pharmaceutical drug database in Africa, whereby we can provide actionable business intelligence. We know in real time which doctors are prescribing which drugs in a particular area, which patient demographic, who's picking up which drugs over here, the disease trends and stats in particular neighborhoods with this. Now the African pharmaceutical market is huge. By 2020 alone, it will reach $45 billion. This is because of a change in demographics, a youthful population, and a switch from communicable diseases to non-communicable diseases. And at the end of the day, we want MPHARMA to help drive this growth by providing high quality data to the pharmaceutical industry. During the hackathon, what we realized was that even though we want a lot of pharmaceutical companies and a lot of doctors to go completely digital, their sample will still want to write prescription on a piece of paper. So we built a simple application that enables doctors to take a picture of the paper prescription that they write, and we digitize that information, include the manufacturer, and we are able to still track it, even if it is written on a piece of paper. And that's a little hack that we built that is included in the ecosystem that we developed for MPHARMA. As part of our market traction, we have a partnership with Example. As I said earlier on, it's become a Bloomberg LP of the pharmaceutical industry in Africa. But it's not a system that just works in Africa. Our goal is to take it to out of Africa, to Latin America, Southeast Asia, and to emerging markets which are seeing an explosion in drug spending, yet lack the basic infrastructure to monitor the use of drugs in those countries. Thank you.